Good afternoon, everyone. Wish you all a very happy, healthy, and blessed 2021. So, first class of this year, we will have Principles of Prescription Writing. This is a very important class because it is an integral part of being a doctor. Writing a prescription is an integral part of being a doctor, and so you have to write a proper prescription. So why is it important to write a proper prescription? Because when it goes fatal, it can cost you a lot, because prescription is a medical legal document, and you can go into trouble if the prescription goes wrong. So what is a prescription? A prescription is a medical legal document given by a prescriber to a patient to be handed over to the pharmacist to dispense the medication. So please remember that prescription is a medical legal document. So you will be allowed to write a prescription only after you complete your internship. So what are the parts of a prescription? So first it should have the date and the doctor's identity, and with the doctor you have to have your name with the degree, the address, registration number. Then you should have the patient's identity, including the name, age, sex and address, and you should have a diagnosis in the prescription. And then we have RJ or RX, which is the superscription. So all this part, the RX is the superscription along with the date and the patient identity. This comes under the superscription of the prescription. Then we come to the body of the prescription, which is also known as the inscription, and then the advice to the patient, which is the subscription. And we have the signature. So without signing, you don't have the prescription is not valid without your signature. So let's discuss what are the importance of each part of the prescription. First is the date. The date is important because we have to know for how many days we are writing, when was the prescription written, when the patient comes for refill, like how many the tablets or the pills should be dispensed. So it is of medical legal importance, and particularly for drugs of abuse, we have to prevent reuse of the same prescription. So the date is very important part of prescription. The doctor's identity is also very important because sometimes the patient may need to contact the physician, and the registration number gives legal right for the physician to prescribe. So only once you have the registration number, then only you will have the right to prescribe. And then the patient's identity is important because sometimes, particularly for tuberculosis treatment or any other treatment, you may have to call back the patient at a particular time. So the patient's identity is also important, and the diagnosis is also very important because of medical legal importance, and it is also helpful to other doctors, patient or pharmacy. Suppose you are not clear what is written in the prescription, then with the diagnosis maybe you will be able to identify which drug the patient was prescribed. And RX or RJ, it means take thou, or it is a connotation to the Greek god of healing Jupiter, and it is also known as recipe, how the drugs or the prescription or the medicine should be taken. After that we have the dosage form, the name of the drug, the dose, the frequency and duration of the drug. So this comes under the inscription. And then we have the subscription, which is information or warning to the patient or advice to the patient and direction to the pharmacist to refill or renew the drug. And then we have the signature or the signature of the doctor. So as a prescription, first you have to have the date, your identity, the patient's identity and the address, the diagnosis, and then RX or RJ, and then we have to have the inscription, which contains the drug, the dosage form, the duration and the dose. Like for example, capsule omeprazole 20 mg OT for 14 days. And what is the advice? Take the capsule in the morning 1 hour before food, avoid spicy food, and review after 14 days. And then you should have your signature. So this gives a complete picture of the complete prescription. So as a prescriber, you have certain responsibilities. You have to have the right patient in the with the right drug, the right dose, the right route, the right time and the right cost. So because to undergo treatment, you have to be very healthy, because apart from your sickness, you have to stand the medicine. So medicine safety is very, very important when you consider prescribing any medication. So the process of rational treatment, first you have to define the patient's problem, specify the therapeutic objective, what do you want to achieve with the treatment, verify the suitability of the P-treatment, that is what is the treatment, the personalized treatment, check the effectiveness and safety, start the treatment, give information, instructions and warning, and then the monitor or stop treatment. So these are the steps of rational prescribing. So a prescription should include name, address, telephone of the prescriber, the date, the name and address, age of the patient, the name of the drug, the strength, the dosage form, the total amount of the drug to be dispensed, the level or instructions or warnings, and signature initials of the prescriber. So the minimum information that should be given to the patient include the effect of the drug, why the drug is needed, which symptoms will disappear and which symptom will not. This is particularly very important because many patients, they expect a sudden disappearance of the symptoms once they start the medicine. So you should clearly define, tell the patient which symptoms will disappear because it will improve the compliance and which will not. When the effect is expected to start, particularly for antidepressant drugs and all, there is a latency for the effect to start, and so there will be a 1 or 2 weeks. So you have to tell the patient that when the effect is expected to start, what will happen if the drug is taken incorrectly or not at all. What are the side effects? Which side effects may occur? How to recognize them? How long will they continue? Certain side effects, they are self-limiting. After some days, the patient gets used to it or the patient adapts to it, or the symptoms discontinue. So how long will they continue? How serious they are? What action to take? Whether with this side effect you have to come back to the doctor or not, you have to ask. You have to inform them. And instructions, how the drug should be taken, whether it should be taken on an empty stomach or at bedtime, twice a day, once a day, when it should be taken after meals or any morning, evening, night, how long the treatment should continue, whether it is for 1 week, whether it's for 3 days, and how the drug should be stored. Certain drugs may need to be stored in airtight containers or to be protected from sunlight or sometimes in the refrigerator. So you have to inform the patient how the drug should be stored and what to do with the leftover drugs. Warnings. Which are the warnings that you should give that when the drug should not be taken? What are the warning signs and symptoms when the patient should stop taking immediately the drug? And what is the maximum dose? For instance, paracetamol. A patient does not, when you prescribe a paracetamol for fever, the fever does not decrease, and so the patient may keep taking and taking again. So you should tell the patient what is the maximum dose of paracetamol that could be taken in 24 hours. Why the full treatment course should be taken should also be explained clearly, particularly in case of antibiotics to prevent recurrence or antibiotic resistance. And the future consultations, when to come back or not to come back, in what circumstances to come earlier, what information the doctor will need at the next appointment. All this should be clarified to the patient. And after all this, you should ask if everything is clear. Ask the patient whether everything is understood. Ask the patient to repeat the most important information. For instance, if rifampicin is to be taken in an empty stomach, you should ask him again. Ask whether the patient has any more questions. So these are some of the prerequisites that you should inform or ask the patient whenever you are prescribing certain medicines. So the principles of good prescribing, you have to state the patient details clearly, including the name, address, date of birth, age, particularly in children and elderly. Take account of any allergies and complete relevant paperwork. See, taking an account of any allergies is important, particularly for some patients which are prone to allergies to penicillins or any other group of medicines. Use generic drug names. State the drug dose, duration, route, frequency. Avoid abbreviations. In all prescriptions, you should avoid abbreviations. Avoid multiple route prescribing. For example, you have some IM preparations, you have some oral preparations, you have some subcutaneous preparations. So if possible, you should avoid multiple route prescribing to prevent the wrong medications being taken by the patient. State the dose is grams, milligrams and micrograms and not as 1 tablet, 2 tablet, and make administration of once weekly drugs. You should be very clear. So these are some of the common Latin abbreviations which are commonly used in the older days, but we advise that you should not be using because it is not being understood by the patients. So for example, when you write AC, it is antecedent, that means before meals. AD, at, means up to. Ad lib means ad libitum, as much as desired or without limit. BID, bisindai, which is twice a day. Caps, capsula or capsules. GTT, gatta, a drop. OD is omnidai, daily or once a day. And HS is hora somni, at bedtime or sleep time, post-sebum PC after meals, PRN pro-re nata when required or as required, Quecora every hour, QD quack dye every day, QID quarter in dye or in dye means 4 times, QID is 4 times a day and TID is 3 times a day, and STAT is statin or at once or immediately. So these were some of the Latin abbreviations which are very commonly used in older days, but now we advocate that you should not be using these ones because sometimes it leads to confusion to the patient. So what are the factors affecting prescribing? You have to assess the patient's clinical state, whether the patient has any concomitant disease, the severity of the current disease, the available treatment, consider likely outcomes like patient-related outcomes or quality of life, likely efficacy of treatment, side effects or tolerability, the interactions both with other drugs. If the patient is being prescribed some other drugs, then you should take into consideration interactions of drug-drug interactions, and even with food-drug interactions you should take into account. For example, monoamine oxidase inhibitors, you should advise the patient to avoid certain food. Compliance or health benefits should be explained, and cost of the drug, it also affects the patient compliance. So prescribing for the children, you should remember that children are not little adults. Many drugs are not licensed for use in children, and you should use a children's formulary or BNF for the British National Formulary for children. And weights and occasionally surface areas are required to calculate accurate doses for certain drugs in children. These parameters may change significantly in relatively small period of time, particularly in infants. For example, a newborn of 3 kg may change to 9 kg at the end of 1 year, or 9 to 10 kgs. So this weight will change, weight or surface area will change significantly in a relatively small period of time. So you have to take care while prescribing for children. Pharmacokinetic changes in the children are important and have significant influence on drug handling. Sometimes the liver, their kidneys are not properly developed, so the pharmacokinetic change in childhood is also very important consideration to be taken into account. And the availability of a product does not ensure its suitability for use in children. Whenever a drug is developed, we first do clinical trials in adults, and so product available does not necessarily mean that it is safe in children. So you should be very careful while prescribing medicines for children. And the same is true for prescribing for the elderly. We know that more than 18% of the population are over the age of 65 years. Absorption, metabolism, distribution and elimination of the drugs are affected by aging. Renal function deteriorates with age. So Alzheimer's disease, dementia and other cognitive disorders, Parkinson's disease, there are important disorders which are common in the elderly. So if these are concomitant like Alzheimer's disease or dementia, the patient may not remember which all medicines have been taken, which all they have to take, which all have not been taken. And so drugs like NSAIDs, opioids, benzodiazepines, etc. are likely to cause problems in the elderly. So you should be very careful while prescribing in the elderly. So there are formularies and essential drugs. You already had class on essential drugs, so I will not go into the details. So these formularies, they provide an independent source of advice. The formularies will contain the details of the drugs which are there in the essential medicine list. So there will be national formularies like British National Formulary. India, we have National Formulary of India. There will be hospital formularies, like they reflect the hospital choices based on the evidence-based and cost-effective evaluation of evidence-based for a drug. For example, certain neuropsychiatric hospitals will have formularies which will contain only the neuropsychiatric drugs. And the WHO also provides a model list of essential drugs, and in India also we have the National List of Essential Medicine, NLEM, which should be revised every 2 years, and even certain hospitals will have their own essential drugs and lists. So while prescribing, you should remember that medication error is a very important part of the drug prescription procedure and the compliance. So what is medication error? It is any preventable event that may cause or lead to inappropriate medication use or patient harm while the medication is in control of the health professional, patient as well as the consumer. So medication error can be on part of any of this, whether it can be healthcare professional, the patient as well as the consumer. So what are the common prescribing errors you should remember? First is the wrong dose. Example, drugs like sound alike. So it can be the wrong drug, it can be the wrong dose of the drug, it can be inappropriate units, Poor or illegible prescriptions can also lead to prescribing errors or medication errors, failure to take into account drug interactions, the omission of certain drugs, wrong route or multiple routes, the calculation errors, particularly in case of pediatric patients, poor cross-referencing. Sometimes I don't remember something, but I don't cross-reference, and this can lead to prescribing errors. Infusions with not enough details of the diluent, rate of administration, etc., particularly in case of inpatients, and poor cross-referencing between charts. So these are some of the common prescribing errors. For example, look-alike drugs may lead to medication errors. The look-alike drugs contribute to medication errors. For example, these two infusion drifts, they don't look different, but they are totally different drugs. The look-alike drugs like metoprolol, tartrate 100 mg, azathioprine, all these look-alike drugs, and even in the same drug there can be the different strength of the drug. So these look-alike drugs, they can contribute to medication errors. And even drugs that sound alike can also lead to medication errors, like cotrimazole or cotrimoxazole. They are totally different classes of drugs, but they may lead to medication errors. Carbamazepine and carbimazole, this may also lead to medication error. Risedronate, methotrexate, and even drugs that look similar in writing, particularly if you abbreviate. Isosorbide mononitrate, some doctors they write it ISMN, and amlodipine is written as istine. So drugs, even when drugs which are similar on writing, they can also lead to medication errors. The once weekly drugs like methotrexate normally is prescribed as once weekly drug, but as this thing, methotrexate prescribed as 15 mg once daily when the correct dose is once weekly. So this is a chart we saw in a hospital. So rather than getting a cross of once weekly, it is once weekly drug. It can be given once daily by the nurse or by the patient if these once weekly drugs are not clearly informed to both the patient as well as the one who is administering the drug. Multiple drugs per prescription can also lead to confusion, particularly in case of elderly patients. As we know that elderly patients, they have multiple comorbidities like hypertension, diabetes, hyperlipidemia, dyslipidemia. So all these can lead to confusion, which all drugs have been taken, which all drugs have not been taken, when to take OD, when to take BD. So multiple drugs, if possible, should be avoided to prevent medication errors. Sometimes poor handwriting by the prescriber can also lead to medication errors. This poor handwriting contributed to medication dispensing error that resulted in a patient with depression receiving the anti-anxiety drug Buspar, that is Buspirone, 10 mg instead of Prozac, that is Fluoxetine 10 mg. So this was not clear to the pharmacist, so the wrong medicine was dispensed to this drug, and this led to medication error. Another is a poor example of poor handwriting. A hypertensive patient accidentally received Vantine 200 mg, which is cefprozdoxim Prosectil instead of Vesotec, which is enalapril, when the pharmacist misread this prescription. So you have to have a handwriting which is clearly legible, because it can lead to dispensing error and it can even harm the life of the patient. So you have to provide a prescription that is legible and which is legal, signed, and giving all information to allow for self-administration. So there should not be any confusion on part of the pharmacist as well as the patient. So in written medication orders, decimals should be avoided. Avoid whenever possible the decimals. Use 500 mg instead of 0.5 grams, or use 125 microgram for 0.125 milligrams. And you should never leave a decimal point naked. You should not write Haldol 0.5 milligram, rather you should write Haldol 0.5 milligram. And you should never use the terminal 0. For example, you should write colchicine 1 mg and not 1.0 mg. And there should be space between the name of the drug, the dose, as well as the unit of the drug. For example, Inderal 40 mg can be confused as Inderal 140 mg. So you should have adequate spacing between the name of the drug and the dose. Quantities of 1 gram or more should be written in grams, like write 2 grams. Quantities less than 1 gram should be written in milligrams, 500 milligram and not 0.5 grams. Quantities less than 1 milligram should be written in micrograms. I write 100 micrograms and not 0.1 milligram. Micrograms and nanograms should not be abbreviated. The word units should not be abbreviated, and calculations should be double checked. The prescriber should read the prescription once it is written. See, once you have given a prescription to the patient, you should reread it again, whether it is clear to you as well as to the patient. The prescribing errors, you should remember that they are the second largest cause of malpractice claims against physicians. And you have to be specific. Explain medications and their side effects. Have patients repeat your instructions and tell them what. Side effects that should elicit a call to your office. Like there are certain side effects, for example, anaphylactic reactions. Then you should tell the patient that they should report immediately to your office. Use the metric system when possible and spell out units rather than writing U, a common misinterpretation which is common in practice. And even include the patient's age and weight whenever appropriate, particularly in case of the children. In case of elderly, you should mention the age and the weight. It also includes a brief notation of the purpose or the diagnosis. For example, for cough, the National Coordinating Council for Medication Error Reporting and Prevention reported one instance in which one order for Haldol, which is an antipsychotic drug, and haloperidol was almost filled with Stedol or butylphenol and analgesic until the filling pharmacist noted that the physician had added for agitation. So if you write a connotation or a notation for what purpose you are writing the drug, then the pharmacist can also make out even if there is a confusion. So in some cases, however, particularly in case of psychiatric patients, patient confidentiality may preclude this from being done. Like you cannot always write the diagnosis clearly in the prescription. You should write legibly and clearly. Bad handwriting and misinterpretation of the medication orders are very, very common cause of medication errors. And if necessary, for clarity, use block letters or capital letters. If my handwriting is very, very bad, I would prefer to write in capital letters. When writing a decimal expression of less than 1, write it out as 0.01 and never use a terminal 0. Never write 1.0 or 2.0. Prescribers should also use avoid the use of abbreviations and Latin directions for use, like BID. Rather than writing BID, you should write twice a day. Or OD, rather than writing OD, you should write once a day. Don't include vague instructions such as take as indicated or resume previous orders. This you will see in many prescriptions in our OPDs. Take as indicated, continue previous orders, resume previous orders. So this should never happen. You should again rewrite the prescription. Always rewrite your existing order. And use microgram, milligram or gram for prescription strength instead of atenolol 2 grams. Take an inventory. Have patients bring in all their medications including over-the-counter drugs and those prescribed by other physicians. Ask how they take each pill and without duplicates of generics and branded drugs, and designate a special place for detailed medication history. And you should always go with what you know. Follow the golden rule of therapeutics. Use the all drugs instead of the all new ones. You should not base your selection on the basis of medical representative. Use the best drug in the class. Sometimes always MR will come with new drugs which has just come up to the market, but you should always use your old drug, because unless the new one has specific advantages, because we don't know the side effects profile, the population, how the population will react to the new drug. So you should always use the new old one if it is permitted. And look it up. Unless you are certain of a certain dose, look it up in a current monograph and incorporate it into your body of knowledge. And this is especially important when prescribing drugs with clinically meaningful drug interactions. So if there is any confusion on your part, you should always look up and check yourself. Reread the prescription before you hand it to the patient. Sometimes we may think something and write something. So before handing it over to the patient, you should always reread the prescription to avoid medication errors. And don't give in to pressures. Resist pressures from the patients or MIs to prescribe certain drugs. Certain patients will come to you that my neighbor or my friend or my sister or my brother, my father was prescribed so and so medication and he or she improved really well with this drug. Can you prescribe me this medication, doctor? But you should never give in to such pressures from the patient. And even the medical representatives may come up with certain drugs to make you prescribe, but you should never give in to their pressures. With drug advertisements targeting consumers, patients are more likely to request a drug that they have heard about. And you should reassure the patient that the drug you have chosen for that particular patient is the best for them and is the most appropriate for him. And we know what to do, but we do. So that we should not be doing. Rather than, we know that we should not give in to pressures, we should not cross the road while it is not green. So you should not do, but we do it sometimes. So let the advertisements not block your intelligence. Reading the fine prints is very important. The drug is 10 times more potent, but in the fine print it may cause renal damage in some. The most effective antibiotic, but it will not be written for what, at what cost. Pharmacoeconomics is also very important for a country like ours, and for what duration. So all these fine prints should be read. So what is rational use of drugs? It requires that the patient receive medicines appropriate to their clinical needs in doses to meet the individual requirements for an adequate period of time and at the lowest cost to them. So you should prescribe the drugs rationally and use of clinical judgment, and the patient should receive the medicines as appropriate to their clinical needs in doses that meet the clinical requirements of that individual and for an adequate period of time, and the cost is also very important. So whenever you are prescribing, you should consider the overall cost of treatment to that patient. So this was about prescribing. So please remember that prescription is a medical legal document which a wrong prescription can land you in trouble. What are the parts of the prescription and what are the important points when you should consider when prescribing to a patient. Thank you.